my name is Brittany Cooper, and this is my head to toe video assessment. I'll go ahead and start by scanning the room so that you know there's no cheat sheets laying around. So before I do anything, I'm noting that I've checked my patient's chart, provided for privacy, I've washed my hands, and now I'm identifying myself along with identifying my patient with 2 identifiers. Hi, my name is Brittany. I'm going to be your nurse today. Hi. Can I see your wristband? Can you tell me your full name and your date of birth?
Leanne Harp, 12-183.
Perfect. Is it okay if I call you Leanne?
Yes.
Okay. And Leanne, can you tell me what brings you in today?
Just routine general checkup.
Okay. And are you currently in any pain?
No.
No? Okay. Just a couple more silly questions for you. Can you tell me where you are?
Your room.
Okay. Can you tell me who the President of the United States is?
Donald Trump.
Perfect. So at this point, I'm noting that Leanne is ANO times 3. So upon inspecting Leanne, I'm noting that her posture is erect. She's dressed appropriately for the situation. Her gait walking in was stable. On her skin, there is no bumps, bruises, lesions, anything like that I can see. Right here, actually on her right thigh, I do see a small bruise, but nothing too concerning. And just looking a little bit more, her skin color is true for ethnicity. I'm just going to go ahead and feel her skin temperature right now. And I am noting that her skin temperature throughout was warm and dry to the touch. I'm going to note right now, too, that if any point her skin color or skin temperature changed, I'll be sure to note that at that time. So moving on to her head. Also, I'm noting that just by looking to her hair seems to be clean and well groomed. So again with the head, do you have frequent headaches at all?
No.
No? Okay. Have you ever had like a head injury?
No.
No? Okay. Have you ever had any like head surgeries?
No.
No? Have you ever played sports?
No.
No? Okay. What about your neck? Is your neck currently in pain?
No.
No? Okay. And have you ever had any like neck surgeries?
No.
No? Okay. Perfect. So still moving on to her head, I'm going to go ahead and palpate Leanne's head. So while palpating, I am noting that I still do not feel any bumps, masses, lesions. I don't feel any patches of hair missing or anything like that. And her skull is normal, so phallic. So moving on down to her eyes, I'm noting right now that her eyebrows and eyelashes seem to be evenly distributed, along with them being full. So once again with the eyes, have you noticed any change in your vision?
No.
No, okay. I do see you have contacts in. Are those prescriptions up to date?
Yes.
Yes, okay. So would you say, do you see like your eye doctor pretty regularly?
Yes.
Yeah, okay. Have you ever experienced like blurred vision or dry eye?
No.
No, okay. All right, so going further into the inspection, I'm gonna go ahead and palpate her eyes. I'm gonna have you look up and look down. Okay, so at this point I am noting that Leanne's sclera is white and her conjunctiva is a nice pink color along with being moist. So now I'm going to do my assessment on her eyes. So I'm just going to have you look at this ear for me, okay? Okay, and then just look at this ear. Perfect. So by doing that, I'm noting that Leanne's pupils are equal, round, and reactive to light so far. I'm measuring her pupils at about 3 millimeters And now I'm going to test for accommodation. So I'm going to have you look at something on the wall, and then when you see my pen light in your vision, just go ahead and focus on that, okay? Okay. So Leanne was also able to accommodate to my pen light as well. So now I'm going to test, do 6 cardinal gazes to test her eye movement. So with your eyes only, just follow my pen light, okay?
Okay.
Perfect. Okay, so at this point I am noting that Leanne's cranial nerves 3, 4, and 6 are intact. For cranial nerve 2, I'm going to note that I would normally use a Snellen chart, but since she sees her eye doctor pretty regularly and her prescription is up to date, I do not feel the need to do that for this video. So I'm going to go ahead and note that cranial nerve 2 is intact as well. Moving on down to her nose. Have you noticed any change in smell?
No.
No. Do you have allergies?
No.
No? Okay. Have you noticed any like weird discharge or anything coming out of your nose?
No.
No? Okay. So to test for patency, I'm going to go ahead and have you plug one nostril and breathe in and out for me. And do the same to the other nostril. Perfect. Okay. So at this point, I'm noting that Leanne's nerves are patent bilaterally. And I'm going to go ahead and take a look up in her nose. Okay, so by looking up in Leanne's nose, I am noting that it was a nice pink color in there. There wasn't, the hair seemed to be distributed pretty evenly, and there wasn't like an excessive amount of boogers per se up in her nose. So with that being said, I'm noting that cranial nerve 1 is intact. Moving on down to her mouth, have you noticed any change in your taste?
No.
No. Have you ever had like dry mouth or anything like that?
No.
No? Okay. And would you say you go to the dentist pretty regularly?
Every 6 months.
Every 6 months, okay. And so now I'm just gonna look inside her mouth to see if I can see anything abnormal in there. So I'm just gonna have you open your mouth, stick your tongue out. You move your tongue up and down, side to side. Perfect. Can you pull your bottom lip down? Okay, and then your top lip. Perfect. Okay. So at this time I'm going to note that Leanne's lips, gums, tongue, hard palate, soft palate, her uvula, her pharyngeal wall, and her buccal mucosa are all a nice pink in color and a nice moisture to it. Her teeth, I did not see any new dental caries, but I did see some old dental work, but she did just state that she goes to her dentist pretty regularly. And then for her tonsils, I'm noting that they're at about a +1, meaning that they are present, but they are not swollen. So at this time, I'm going to have you open your mouth, stick your tongue out, and say ah. Perfect. So I am noting that by Leanne doing that, her soft palate rose and her uvula moved back, stating that cranial nerve 9 and 10 are intact. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. By her stating that, being able to say that back to me, I'm noting that cranial nerve 12 is intact. While I'm right here, I'm going to have you shrug your shoulders. Okay. Put your hand against mine. Yeah, there you go. Same thing. Perfect. Okay. By Leanne doing that, I am noting that cranial nerve 11 is intact. So moving back on up to her jaw, I'm going to do cranial nerve 5 and do the motor part of it. So I'm going to have you open your mouth, close it, and side to side. Okay. So I am noting that I did feel some clicks with movement of her jaw, but she was still able to move. And like I said before, she still goes to her dentist pretty regularly. So I do not think anything is too concerning there. So for the sensory portion, I'm going to put this on your face. Just tell me where it's at and if it's sharp or dull. And I'll have you close your eyes while you're doing this, okay?
Okay.
All right, so whenever you're ready. Cheek.
Sharp. Forehead sharp. Chin dull.
Sorry.
Forehead dull.
Perfect. Okay, so by doing that, I'm now noting that Leanne's cranial nerve 5 is intact. Doing number 7, can you raise your eyebrows? Okay, puff your cheeks. Perfect. Stick your tongue out. Smile. Perfect. I'm noting that Leanne's cranial nerve 7 is intact. So moving right now, I'm going to go ahead and feel her temporal arteries, her lymph nodes, and then move to her ears. So this is her temporal artery. I'm noting those are about at a +1 and equal bilaterally. Now I'm going to feel her lymph nodes. So starting with her preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, posterior cervical. I'm going to have you do one of these. Thank you. Her deep cervical chain. On the other side? I'm just doing it on the other side. And then I'm going to have you do one of these as well. Okay. And this is her supraclavicular. Okay. And I am noting that I did not feel those, so that indeed is a normal finding. If I was able to feel them, they should be soft, non-tender, and able to move. So now moving to her ears. Have you noticed any change in your hearing?
No.
No. Have you ever felt like your balance was ever off?
No.
No? Okay. And do you have like frequent ear infections or anything like that?
No.
No? Okay. So I'm just going to go ahead and take a look inside Leanne's ears. Perfect. I'm going to look at the other side as well. Okay. So I am noting that inside Leanne's ears, it was a nice pink color to it. And I did not see any excessive amount of rumen in there, and the hair seemed to be evenly distributed on both sides. At this time, I'm going to go ahead and just do one of these. Okay. And I'm noting that the top of Leanne's ears are aligned with the outer canthus of her eyes. So that is also indeed a normal finding. So now I'm going to perform what's called the push-pull-push. If there's any pain or tenderness at all, you just let me know, okay?
Okay.
Okay. So I'm pushing on her tragus, pulling on her pinna, pushing on her mastoid. No? Okay, that's perfect. So now I'm going to perform what's called the whisper test. I'm going to go behind you. You'll hear a sound on either your right or your left. Whenever you hear that sound, just go ahead and raise that hand, okay?
Okay.
All right. Perfect, okay. So Leanne was able to hear those sounds on both her right and her left, so that is indeed a normal and good finding. So now I'm going to have you stand up. Close your eyes. Perfect. Go ahead and sit down. Okay, so what I performed there was called the Romberg test. She was able to stand up, close her eyes, and her balance. She wasn't swaying or anything like that, so that is indeed a normal finding. And with all that being said, I am noting that cranial nerve 8 is intact. So, and at this point, I'm going to go ahead and note that her Glasgow Coma scale, I would rate it at a 15 out of 15, considering she's able to open her eyes spontaneously. She's able to answer my questions, and so far she's, everything's been appropriate for the conversation. So, like I said, a 15 out of 15 for that. So, I'm just going to recap on the cranial nerves real quick to make sure I had everything. So I did cranial nerve 1, testing her sense of smell, seeing if her nares were patent on each side. Cranial nerve 2 was the Snellen chart. Cranial nerve 3, 4, and 6 were the 6 cardinal gazes along with Perla. Cranial nerve 5 was her TMJ. I did the motor portion and the sensory portion with the sharpened dull. 7 was raising her eyebrows, puff her cheeks, stick her tongue out, and smile. So I did that as well. 8 was her ears. 9 and 10 were her opening her mouth, saying ah. So her soft palate rose and her uvula moved back. 11 was her shrugging her shoulders and then resisting my hand on both sides of her face. And then 12 was light, tight dynamite. So once again, I'm noting that all of those are also intact. Moving on down to her neck. So you said you did not have any neck pain?
No.
Or neck surgeries? No. Okay. So now I'm just inspecting Leanne's neck. I do not see any tumors, masses, any bulging of any sort, nothing like that. So I'm just going to go ahead and palpate her carotids. Okay, and then the other side. Okay, so at this time I'm noting that Leanne's carotid arteries are +2 and equal bilaterally. So while I have her right here, I'm just going to have you lay flat for me. Okay, and then I'm going to raise her to about a 45-degree angle. Go ahead and sit up. Okay, it's roughly. Go ahead. Perfect. Go ahead and sit back up. Okay. So I was testing to see if Leanne had any jugular vein distension, and by seeing that I did not see any, so that is indeed a normal finding. So now I'm going to move on to auscultating those carotid arteries. So for this, when I'm going to have you inhale and exhale, and on the exhale I just need you to hold it, okay? I'm also going to be doing this with the bell of my stethoscope. So whenever you're ready, you just go ahead and start. Go ahead and breathe. Whenever you're ready for the next one, I'm ready. Go ahead and breathe. Whenever you're ready, I'm ready for the next one. Go ahead and breathe. Okay, that's perfect. So while I was auscultating Leanne's carotids, I'm noting that I did not hear any bruits, so that is indeed a normal finding. Okay. Moving on down to her anterior chest. Have you had any chest pain?
No.
No? Any difficulty breathing?
No.
No? Okay. You ever feel like maybe an elephant is sitting on your chest? No? Nothing like that? Okay. Real quick before I move on, I just noticed recapping that I kind of forgot something. So can I have you tilt your head up and swallow for me? Perfect. Can you move your head left and then to the right? Perfect. Okay, so by doing that, I'm just noting that Leanne's trachea was not deviated, anything. She did not have any trouble swallowing. So that is indeed also a normal finding. So now going back to her chest. Those questions were all no's. So now I'm just going to go ahead and palpate for crepitus. So while I was palpating, I did not feel any crepitus, so that is indeed a good finding. So now I'm going to move to percussing her lung fields, so to map these out. On the front, they are from the clavicles down to the diaphragm, so that's where I'll be percussing and auscultating as well. So to do percussion, I'm going to go ahead and start doing that. Is it okay if I lift your shirt up? Okay. Perfect. Okay, put it the right way now. Okay. So while I was percussing, I'm noting that I did hear resonant sounds. So that is indeed a normal finding. If I was to hear like a dull sound, that could indicate like a tumor, a mass of some sort. So now moving on to auscultation of the lungs. For this, I will do this with the diaphragm on my stethoscope. And what I'll have you do is every time you feel my stethoscope, you just inhale and exhale. Okay? So whenever you're ready, I am ready. Can I let you show up again? Perfect. Okay, I'm gonna put your shirt back down. Okay, so while I was auscultating Leanne's interior chest, I'm noting that I did not hear any adventitious sounds. So like no wheezing, no crackles, no rhonchi, anything of that nature. So that is indeed a normal finding. While I'm right here on the anterior chest, I'm gonna go ahead and move to the heart. So I've already inspected the chest. So still I have not found any lesions, any bumps or bruising or anything like that on her chest. And the temperature is still warm to the touch, warm and dry to the touch. Testing skin turgor. I'm noting that there was no tenting, so that is indeed a normal finding, proving that she is not dehydrated. So now doing her heart, I'm going to be doing aptiman, which is starting at the aortic. It'll be the second intercostal space, right sternal border. Then moving to the pulmonic, which is the second intercostal space, left sternal border. Going down to Erb's point will be her third intercostal space, left sternal border. Going to the tricuspid, which is then the fifth intercostal space, left sternal border. And then going to the mitral, which is her fifth intercostal space, midclavicular line. So I'm just going to go ahead and listen to those with the bell of my stethoscope. Starting at the sternal notch, I will go down to the angle of Louis going over, and that will be my first point. I'm gonna lift your shirt up again, okay? And then I'm just gonna lift your bra up a little bit, okay? Perfect. Pull that back down. Okay. So while I was auscultating Leanne's heart sounds, I am noting that the S1 and S2 sounds, the rate and rhythm were regular. I'm noting that at the apices of the heart. Excuse me, not the apices. At the aortic, pulmonic, and Erb's point, S2 is louder, and then at tricuspid and mitral, the S1 would be louder. So that's indeed a normal finding. So now we're gonna go ahead and move to the posterior side. So I have you swing that way. Okay, so upon inspection, I'm noting that Leanne's skin color is still true for ethnicity. This temperature is still warm and dry. I'm just gonna kind of feel, okay. I am noting a small tattoo on her left scapula and then a larger tattoo down here on her lower back. So, like I said, I'll still continue to assess, and if anything changes, I'll be sure to note that. So starting with palpation, I'm going to palpate for crepitus. Okay, so I'm noting that I do not feel any crepitus. So now to map out my lung fields, I'm going to start at C7, going down to the bottom of the scapula would be T7, 3 more spaces would be T10, and at this point, I'm gonna go ahead and, I'm actually gonna lift your shirt up for this, okay? Sorry.
You're good.
So once again, T7, 1, 2, 3, to T10. So go ahead and take a big deep breath in and out. Perfect. So that right there was called symmetrical expansion. By placing my hands like that, I was able, when she did it inhale and exhale, my hands did rise and fall symmetrically, so that is indeed a normal finding. So now I'm going to do what's called tactile fremitus. So every time you feel my hands, say 99, okay?
Okay. 99. 99. 99. 99. 99.
Perfect. Okay. So doing that, I am noting that at the top it was louder and then it diminished as it went down, so that is also a normal finding. So now I'm going to do AP diameter, looking at the side of her, measuring here, and then coming around to here. I am noting that her AP diameter is indeed a 1:2 ratio, so that is also a normal finding, noting that there is no barrel chest or anything of that nature. So, crepitus, tactile fremitus, symmetrical expansion, AP diameter. Okay, so now I'm going to move on to percussion. I will, like I said, I'll percuss from her C7 down to T10 where my lung fields are. All right. Pulling up your shirt again. Okay, perfect. So while I was percussing, I am noting that I did hear a nice resonant sound. So that indeed is a normal finding. Same thing on the posterior. If I was to hear like a dull sound or anything of that nature, that would indicate a mass or tumor, like I had stated before. So now to auscultate, I'll also auscultate in those same spots with the diaphragm of my stethoscope. Same thing, Leanne. Whenever you hear or feel my stethoscope, go ahead and take a big deep breath in and out for me. Whenever you're ready. So I'm going to go ahead and lift your shirt again, okay? Perfect. Okay. So while I was auscultating Leanne's posterior chest, I am noting that I did not hear any adventitious sounds, no wheezing, no crackles, no rhonchi, anything like that. So that is indeed a normal finding. Okay. So moving to her extremities, Leanne, I'm going to have you turn back around and then sit back on the bed a little bit, like with your feet. Yeah, that's fine. That is good. Okay. So, looking at Leanne's arms and legs, I'm noting that the skin color is still true for ethnicity. The temperature is indeed still warm and dry to the touch. I do not feel any edema on her upper or lower extremities, so that is also a good finding. I'm going to note that I do see a small tattoo on her at the top of her foot. Okay, and then I will still continue to assess throughout. All right, so I'm going to go ahead and feel her radial arteries. Those are also at a +2 and equal bilaterally, going on up to the brachial arteries. Those are also at a +2 and equal bilaterally. I'm going to go ahead and do her capillary refill on her fingers. Other hand. Okay. I'm noting that her capillary refill is less than 3 seconds, so that is indeed a normal finding. I did your arteries, I did your cap refill, I did your temp and stuff. I'm going to have you grab my fingers, okay, push against my hands, and then, I'm sorry, pull, there you go, pull against them, there we go, okay. I'm going to have you, I'll have you stick your hands out to the side, close your eyes, and then touch your finger to your nose. Perfect, okay. So doing that, I'm just noting Leanne's, her strength in her both upper extremities are equal bilaterally, and then her being able to touch her nose is also a part of cognition. So that was a normal finding as well. Moving on down to her legs, I'm going to go ahead and feel her popliteal arteries. These are usually hard to find, so if I do not find them, I'll definitely know that. So I'm just going to have you kind of a little bit. There you go. Okay, I actually felt them that time, and they are at a +2 equal bilaterally. Going down to her posterior tibial. Okay, those are also at a +2 and equal bilaterally, and then going down to the dorsalis pedis. Okay, those are also at a +2 and equal bilaterally. So while I'm down here, I'm going to go ahead and do capillary refill on her toes. Okay, so I am noting that her capillary refill is less than 3 seconds, so that is indeed a normal finding. While I'm down here, I'm going to perform the Sharpendahl technique and the Babinski reflex. So doing this, I'm just going to have you, I'll probably have you close your eyes, and then you just tell me if it's sharp or dull, okay? All right.
Sharp. Dull.
Sorry.
Sharp. Dull.
Okay.
Sharp. Dull.
Sorry.
dull? Sure.
Perfect. Okay. So Leanne was able to identify sharp and dull, so that is a normal finding, and I'm gonna go ahead and now do Babinski reflex. So by doing that, her feet reacted because she was very ticklish on her feet. But normally there would be no reaction, which is indeed a normal finding. Okay, so just to kind of recap. Oh, okay, I know what I did. Can I have you? Might be easier to slide. Maybe. Can I just have you slide your heel down your? There you go. Yeah, and then the other side. Okay, perfect. So that is also, that was good as well. She was able to follow my command and do it in a nice manner. Okay, so now I'm going to move on to the last part of this video, which is the abdomen. I now have to move the camera to a different position and have the patient lay in a different position. So we're going to go ahead and do that right now. Go ahead, you can go ahead and lay down. Okay, let's see if we can get this in the right position. Pull these down a little bit further. Okay, cool. So, I'm just gonna sit here so you can see my face for a little bit. So upon inspecting Leanne's stomach, I am noticing that I do see a little bit of striae. Her umbilicus seems to be midline. I do not see any bulging or masses of any sort. I am noting that her contour is flat, and I do not see an aortic pulsation, and I'm also noting that I do not see any heaves or lifts right here on the apices of her heart. Okay, so to ask a couple questions, Leanne, do you take any medications?
No.
Okay. When was like your last menstrual cycle?
2 weeks ago.
2 weeks ago? Okay. Have you noticed any like changes in your appetite?
No.
No? Okay. When was your last bowel movement?
Today.
Can you tell me the consistency of that?
Normal and brown.
Normal brown. Okay. Have you noticed any like blood or mucus in your stool or urine?
No.
No. Okay. How often do you say you would urinate pretty often?
Yeah.
Yeah. Normal. Okay. Does it ever burn when you urinate?
No.
No. Okay. And do you know how to perform a breast self-exam?
Yes.
Yes. Okay. And assuming, do you have an OBGYN?
Yes.
Okay. Sounds good. Okay. So now moving on to the actual assessment for Leanne. I'm going to go ahead and auscultate first, because if I was to palpate or percuss, I could present some bowel solids that aren't really there. So I'm going to go ahead and auscultate first with the diaphragm of my stethoscope in all 4 quadrants. Okay, so I'm just going to go ahead. Perfect. Okay, so while I was auscultating Leanne's bowel sounds, I am noting that they are present in all 4 quadrants. I would rate them normal active, and I did hear between 5 to 30 sounds in each quadrant. If I was to hear nothing at all, I would have to listen for 5 minutes in that one quadrant. But since that's not the case here, that is indeed a normal finding. So now I'm going to go ahead and auscultate the aortic, or aorta, her right and left renal, and her right and left iliac. So I'm going to do that with the bell of my stethoscope. Making a W with my fingers and placing it right above the umbilicus. The aortic will be up here, and then her left renal will be over here, and her right renal will be over here. And then making a V below the umbilicus will be my iliacs. Alright, so while I was auscultating Leanne's arteries in her abdomen, I'm noting that I did not hear any bruits or anything abnormal while I was auscultating those. So that's also a normal finding. So now I'm going to go ahead and move to percussing a couple spots in each quadrant, starting with the right lower. Okay, so while I was percussing, I did hear tympanic sounds, except for a slight dullness in the right upper quadrant where her liver is, but that's to be expected due to that organ. Other than that, the tympanic sound is a normal finding. So now I'm going to move on to a light palpation, starting in her right lower quadrant as well. And if there's any pain or tenderness while I'm doing this, just let me know, okay? Okay, so while I was palpating Leanne's abdomen, I did not feel any lumps, masses, tumors, anything like that. If I did, for some reason, I would do a deeper palpation, which is about 4 to 5 inches deep, but just for the sake of this video, I will not do deep palpation. So I believe that is it for the abdomen. Leanne, do you have any questions for me?
No.
No? Okay. Thank you.